Welcome to the Workplace Minute, powered by H3HR Advisors and sponsored by Paychex, one of the leading providers of HR, payroll, retirement, and software solutions for businesses of all sizes. My name is Steve Boese. Health benefits in 2024, higher premiums, and impact from GLP-1 medications. The average annual premium for workers covered by their own company in 2024 was $8,951 for single coverage and $25,572 for family coverage, according to data published in the journal Health Affairs. The 2024 averages were 6% higher for single coverage and 7% higher for family coverage than in 2023. For comparison, the inflation rate over the course of the past year was 3.2% and wage growth was 4.5%. And during the past 5 years, the average premium for family coverage has risen from $20,576 to $25,572, an increase of 24%. And during the same period, the inflation rate was 23% and wages grew by 28%. This was the second consecutive year of 7% growth in premiums, resulting in 14% growth over the course of the past 2 years, compared with only 5% growth between 2020 and 2022. Beyond the headlines of the total premium costs, the survey also examined how companies covered or did not cover the increasingly popular and expensive family of weight loss drugs known as GLP-1s. Fewer than 1 in 5 employer-sponsored health insurance plans covered weight loss drugs in 2024, according to the survey. And that's not changing anytime soon either. Only about 3% of employers that didn't cover GLP-1s for weight loss, like Wegovy and Zepbound, said they'd be very likely to do so in the next year. Health plans typically cover these medications for people with diabetes and some other conditions. However, they've been pressed to extend coverage when the primary purpose is weight loss. Obesity is an important contributor to poor health and affects a large share of the population, and these medications may be a treatment option. However, weight loss drugs can present quite a strain on company healthcare budgets. They retail for over $1,000 for monthly supplies, and most research indicates patients need to remain on these drugs indefinitely for them to have maximum effectiveness. Despite their popularity with the public and their effectiveness, most large firms still don't want to pay for them. Employers are really trying to thread the needle right now, said Matthew Ray, the author of this study and associate director for the program on the healthcare marketplace at KFF. They're trying to figure out what is the right balance between the advantages to employees, potential health benefits, and the cost of these drugs. And at this point, these things aren't sorted out. The exact numbers aren't clear. It was a self-reported survey, and surprisingly, almost a third of the respondents did not know if their plans covered GLP-1s or not. So while only 18% of the employees said they did cover them, in reality that number might be slightly higher. While Congress is hoping drug manufacturers will eventually lower the price of these weight loss drugs, the high cost and the lack of coverage remains an issue for those in need. People who are rich can't afford to pay the $1,000 per month for this medication, said Susan Spratt, an endocrinologist and senior medical director for the Population Health Management Office at Duke University. We are just widening health disparities by making it harder for patients to access these life-changing medications. But the study's author clarified that employers aren't necessarily at fault for this either. The price of such plans is simply unmanageable for even the largest firms. With the average health insurance premium being $25,000 for a family of 4, or just over $8,000 for a single person, said the authors, if you've got a third of your workers taking a $10,000 drug, that's obviously going to lead to significant impacts. As 2024 heads towards a close, it will be interesting to see how both the overall healthcare costs and coverage of GLP-1s trend in 2025. Companies are in the process of enrolling employees for 2025 now, and these tough choices are ones that will have repercussions in the new year. We will continue to follow all the important topics and trends in the world of work here on the HR Happy Hour Media Network. That's it for the Workplace Minute, powered by H3HR Advisors.